Hey everybody, down here in the corner again, it's Dr. Chris Bunn from Atlas Clinic here in South Ogden. I want to talk to you today about sleep apnea, snoring, difficulty catching a full breath. We have what's called in our society right now an epidemic of bad posture, and a lot of it's caused by this. Some of you have probably seen that. You might be doing it right now while you're watching this. We have a whole generation of people who are bending their heads forward. Now, what begins to happen with that is that you lose the normal curvatures that you're supposed to have in your neck. And if there's been some sort of an injury to the upper cervical spine, this area right here, the atlas, which we like to treat a lot around here, and the axis, the occiput, where it sits on the brainstem right there, the neck can instinctively tighten up with the musculature in the neck, and you end up getting what's called either a forward head posture, where it's bent forward, or it's straight up and down, what we call a military neck. Now, the problem with that, and what happens with that, is that as this neck straightens up, the airway area behind the tongue and behind the jaw becomes compromised. Right? What's the first thing that you do when you're doing CPR? You sweep the food out of the mouth, but if somebody's laying down, you tilt their head back, and that opens up the airway, right? So once we start adjusting this, once we identify this, we start adjusting the atlas vertebrae and the upper cervical spine, what you start to see is here's before. So one of our patients, he had 5.6 millimeters of airway space. We start treating him. We take a next one. This is the very next view that we get of him. And you can see how this whole area has begun to open up. We're starting to get more of a curvature here in the upper cervical spine, but we've gone from 5.9, I think it was 5.9. Well, it's not going to let me go back, to 8.6. So we added almost 3 millimeters of airway space, which is going to be a humongous difference for him. Having this airway open, this is a young athlete, soccer guy, just having a lot of hard, difficulty breathing when we first started seeing him. Now we have an open airway. The neck's starting to relax. He's suffering a heck of a lot less pain, and yeah, so this is hopefully this is of interest to you guys. But this is what we're able to accomplish up here with our advanced imaging. We can see this really in depth and detail and measure it. Here they are again side by side. You can see that 5.6, 8.9. Again, hit us up. Hit the link on the. It should be right below this video. It's atlasclinicutah.com. We do free initial consultations and imaging. Again, thanks for your time, and hope you've enjoyed this. We'll talk to you soon.